Hello everyone, it's Mimi here. BMS working in the NHS. And today's video will be about fixation, which is part of the IBMS specialist portfolio in cellular pathology. So, just a quick introduction to this video. It will be short and sweet, I promise. It will be focused on the first subsection of the specialist portfolio called fixation. I will discuss knowledge requirements, competence requirements, reflective statement, evidence of achievement, Q&A suggestions, evidence ideas, and some helpful tips to make candidates' portfolio really good. With all that said, I hope you will enjoy the content of my video and I hope you will learn a lot. So let's dive into the first subsection of the first section, tissue preparation techniques, called fixation. The knowledge requirement explains what knowledge is expected of the candidate in relation to the relevant subsection. Candidates should be able to demonstrate their knowledge at the specialist level. Think about what knowledge they had as a Band 5 BMS. How would that differ to the knowledge of a Band 6 BMS? That specialist level of knowledge would allow the candidate to troubleshoot, problem solve, verify or validate. Let's have a look at the first knowledge requirement, which is changes that cells and tissues undergo when they are removed from the body. Candidate needs to have the knowledge and understanding about changes that cells and tissues undergo when they are removed from the body. You could ask them to explain what those changes are. Or ask them to explain what is happening to cell tissues when they are removed from the body. When addressing this knowledge requirement, candidates should consider agonal changes of post-mortem and surgical tissue, hypostatic congestion, coagulation, capillary expansion, edema or dehydration, anoxia, autolysis, putrefaction, liquefaction, gas formation, dilation, cell swelling, enzyme release, rigor mortis, loss of homeostasis, loss of ADP, ionic imbalance, metabolic reactions, nutrients and oxygen intake by cells. Candidates should be able to link all this to fixation. The second knowledge requirement is which samples require fixation and which do not. Candidates should know which samples in your lab require fixation and which do not. You could ask them to explain what samples in your lab do not need to be fixed for analysis. When addressing this knowledge requirement, candidates should consider frozen sex, immunofluorescence samples, samples for molecular testing or metabolic studies, non-gynae samples or samples shared with other departments such as micro or virology. You could ask them to explain, why are those samples not fixed, and what would happen if they were fixed. The third knowledge requirement is assess the risks of handling unfixed tissues. Candidates should be able to assess the risks of handling unfixed tissue. You could ask them to name the risks associated with handling unfixed tissue. Or to name what PPE and safety measures are available to them when handling unfixed tissues. When addressing this knowledge requirement, candidates should consider clinical details, infection risks, use of sharps on unfixed samples, containment, vaccination, and so on. Candidates should be able to explain how they would personally deal with unfixed sample, and this should be in accordance with local SOPs and safety protocols. The fourth knowledge requirement is cross-linking, precipitating and denaturing mechanisms of fixation. Candidates should be able to know about various mechanisms of fixation. You could ask them to explain what mechanisms of fixation are. To explain what is cross-linking, precipitating and denaturing mechanism of fixation. To name a few examples of fixatives that have those mechanisms of fixation. You could ask them to explain how those fixatives and mechanisms of fixation differ. When addressing this knowledge requirement, candidates should consider specific fixatives used in their lab, what mechanisms of fixation do they use and when are they used, to specifically aldehydes and alcohols fixatives. You could ask them if they are aware of any other mechanisms of fixation? And if so, can they give some examples of those as well? For example, oxidizing fixatives. The fifth knowledge requirement is mode of action of common fixatives. This links nicely to the previous requirement. Candidates should be able to know about the mode of action of common fixatives. You could ask them to name the common fixatives. To explain what is a mode of action when it comes to fixatives. To name fixatives that are used in your lab and to state their mode of action. When addressing this knowledge requirement, candidate could consider histological and non-gynae fixatives to demonstrate their knowledge. The sixth knowledge requirement is impact of poor fixation on diagnosis. Candidate should be able to know about the impact of poor fixation on patient diagnosis. You could ask them to explain how fixation can affect diagnosis, or what they would see under the microscope when it comes to poorly processed tissue. You could ask to elaborate on that and explain how could those microscopic features affect the diagnosis. When addressing this knowledge requirement, candidate could consider over and under fixation, structural damage, cellular degradation, compromised molecular analysis, artifacts, weak or inaccurate staining, misinterpretation, unreportable sample, act on digital pathology and AI algorithms, tissue shrinkage, morphological alterations, or antigen masking. You could ask them to state what the appropriate fixation time for fixative used in your lab is. Or how would they know if tissue has been in a fixative for appropriate time? You could ask them to explain how they would deal with sample that was poorly fixed. Candidate should also be considering sample to fixative ratio, or samples that are large or dense and might need opening or slicing to guide fixation, and so on. The seventh knowledge requirement is practical impacts of penetration rates of fixatives into tissues. Candidate should be able to know about the practical impact of the penetration rates of fixatives into tissues. You could ask them to explain what penetration rate of a fixative was. You could be more specific and ask them what penetration rate of the fixative you used in your lab was. You could ask them to name aspects that could affect the penetration rate of a fixative. Or you could ask them to name the practical impacts of penetration rate of a fixative. When addressing this knowledge requirement, candidate could consider length of time tissue needs to be in a fixative, tissue morphology, staining quality, antigenicity, autolysis and putrefaction, size of tissue, volume of fixative, fixative type and so on. The eighth knowledge requirement is the fixation reaction time and its impact on specimen handling and processing. This requirement links closely to the previous one about penetration rate. Candidate should be able to know about the fixation reaction time and its impact on the specimen handling and processing. You could ask the candidate to explain what fixation reaction time was, what factors affect fixation reaction time, how reaction time affects specimen handling, and how fixation reaction time affects specimen processing. You could ask them to explain why fixation reaction time is affecting handling and processing of samples, or what would happen to the specimen during processing if fixation reaction time was not optimal. When addressing this knowledge requirement, candidate could consider tissue density, properties of fixative used, temperature, subsequent analysis, penetration rate, over and under fixation, and so on. The ninth knowledge requirement is risks and hazards associated with use and disposal of fixatives. Candidate should be able to know about the risks and hazards associated with the use and disposal of fixatives. You could ask them what the risks and hazards associated with fixatives are, how they could minimize them, or how they would dispose of fixatively. You could ask the candidate to explain what precautions are in place in your lab to minimize risks and hazards associated with fixatives. When addressing this knowledge requirement, candidate could consider different types of fixatives, their exposure limits, monitoring of exposure, different ways of disposal, health hazards, safety hazards and so on. The 10th knowledge requirement is properties of a perfect fixative and factors affecting optimal fixation. Candidate should be able to know about properties of a so-called perfect fixative, and talk about factors that can affect optimal fixation. You could ask the candidate to name properties a perfect fixative would have, or to name factors that can affect optimal fixation. When addressing this knowledge requirement, candidate could consider safety, price, fixative properties, application, effects on further testing, versatility, compatibility, and so on. As for factors affecting fixation, they could consider tissue size, fixative properties, time, temperature, agitation, and so on. The 11th knowledge requirement is relative merits of fixatives used in cellular pathology. Candidate should be able to know about the relative merits of fixatives used in histology. You could ask the candidate to talk about the relative merits of fixatives used in histology. You could ask them to explain what fixatives are used in your lab and why are they used. When addressing this knowledge requirement, candidate could consider mode of action, advantages, disadvantages, versatility, and compatibility of various fixatives. The 12th knowledge requirement is mechanism of fixation and relative merits and risks associated with named fixatives. Candidate should be able to know about mechanism of fixation, relative merits, and risks associated with named fixatives. This is best demonstrated in a table, I believe. So you could create a table for the candidate to fill in. You could ask them what each of those fixatives are, what is their mechanism of fixation, what risks are associated with them, and how would they dispose of them, what their advantages and disadvantages are, and when would they use each of them. Competence requirement is basically a combination of knowledge, skills, and experience candidate needs to perform a job to a satisfactory standard. Candidates' chosen evidence should demonstrate these competence requirements. The following competence requirements need to be met for this subsection. The first competence requirement is select and use appropriate fixative solution. Candidate should be able to select and use appropriate fixative. If applicable, can the candidate use multiple types of fixatives? If so, do they know when to use each fixative, and why they are using them in your lab? Does the candidate know it's important to know when to use appropriate fixatives? Does the candidate know how fixatives affect further testing and diagnosis if used incorrectly? When addressing this competence requirement, candidate could consider fixatives in routine histology, non-gynae area, for frozen sections, for EM and so on. The second competence requirement is ensure appropriate fixation of specimens. Candidate should be able to ensure that samples are appropriately fixed. Does the candidate know if sample has been fixed appropriately? Or during which tasks in the lab it is necessary to check the fixation state of the sample? When addressing this competence requirement, candidate could consider factors affecting fixation time, specimen size, penetration rate, checks during dissection and so on. The third competence requirement is prepare fixative solutions following SOPs and maintain appropriate records. Candidate should be able to prepare fixatives by following SOPs and maintain appropriate records. Does the candidate know how to make up any fixative solutions in your lab? If so, can they find and follow the rest in the SOP? Can they record correctly making up fixatives? Does the candidate know if it is okay to use made fixative? Are they aware of verification process? Does the candidate know where to record making up solutions? When addressing this competence requirement, candidate could consider SOPs, verification, validation process, record keeping and documentation. The fourth competence requirement is apply appropriate safety practices to handling, using, and disposal of fixative solutions. Candidate should be able to apply appropriate safety practices to handle, use, and dispose fixatives. How does the candidate handle, use, and dispose of fixatives? Are they working in a safe manner? When addressing this competence requirement, candidate could consider PPE, use of extraction hoods, exposure limits, exposure monitoring, various disposal methods for fixatives, and how they apply them in their practice. The fifth competence requirement is monitor environmental hazards associated with fixative solutions. Candidate should be able to monitor environmental hazards that are associated with fixatives. What monitoring systems can the candidate use in your workplace? When addressing this competence requirement, candidate could consider air monitoring, waste management, exposure limits, available PPE, risk assessments, spillage cleanup and so on. The sixth competence requirement is troubleshoot problems which may arise, including root cause analysis, if appropriate. Candidate should be able to troubleshoot problems and perform root cause analysis. Does the candidate know problems may arise due to fixation? Would they know how to troubleshoot them? Would the candidate know how to perform root cause analysis? When addressing this competence requirement, candidate could consider various problems with fixation, investigation steps, identification of problems, CAPA, appropriate documentation and preventive actions. Each section also contains reflective statement which is asking the candidate to summarize their role in the lab in the context with each section. When they complete all the subsections within each section, they will be required to write a reflective statement. They also need to write a personal reflection on their training and why they chose their evidence. To prepare for that, ask them to write a smaller reflective statement for each subsection. What is their role and context of this subsection within the lab? What does their evidence demonstrate? Ask them to write a smaller justification as to why they chose their evidence for this subsection. Also ask them to write about what was their training like when to this subsection. Writing a smaller reflective statement at the end of each subsection will then make it much easier for them at the end of the section. Each subsection also has evidence of achievement. This is a part where you, the training officer, sign the candidate off as competent and fit to practice as a BMS at the specialist level. By doing that, you will confirm that the candidate can work in accordance with local SOPs relevant to this subsection. This will also confirm that candidate has answered questions set by you to test their knowledge and skills relevant to this subsection. And you will also confirm that candidate's chosen evidence demonstrates their competence relevant to this subsection. The candidate will need to be signed off as competent by an internal assessor for each subsection. They can be signed off by you, the training officer, senior BMS overseeing relevant section, or by the training lead. These are some example questions you could give your candidate to test their knowledge and skills about this subsection. These should be based around the knowledge and skill requirements mentioned earlier. You could ask the candidate to complete tables you created, based on knowledge requirements. These are some more example questions you can ask your candidate to complete, to test their knowledge and skills about this subsection. Supporting evidence should be selected by the candidate. It needs to be based around the competency requirements, and be relevant for each subsection. The evidence should allow the candidate to demonstrate their competence in each subsection. It should be specific and relevant to the candidate's in-house practice. It should also demonstrate candidate's specialist competence. If you would like to see specific ideas for supportive evidence, please have a look at the video for trainees. Link will be included in the video description. I would also like to share with you some helpful tips that can make candidates' portfolio look really good. Ask them to try and present the information in various formats such as tables, pictures, photographs, diagrams, flowcharts, graphs, or even videos, if they can. This nicely breaks down a lot of text that is usually present in specialist portfolios. Ask them to try and make it a little bit more interesting to the reader, which will be you, and eventually the assessor. Ask them to try and put themselves in your or the assessor's shoes. How would they like to read hundreds of pages of plain text? There is a saying I really like, and it goes like this: a picture 1,000 words. I will make a video where I will share with you my evidence I used for my portfolio back in the day. Hopefully that will help. Also ask them to try and use various types of evidence, not just one type, like case studies, for each subsection. They could use experiments, case studies, annotated results, annotated photographs of them performing tasks, evidence of troubleshooting, annotated EQA results, nonconformances, validation verification evidence, comparisons of different approaches and their pros and cons, control material production, certificates of course attendance with reflective statements, annotated images or charts, and so on. Ask them to try and bring in their personality. Ask them to think about the ways they like to learn best. If experimenting, let them perform experiments. If they like troubleshooting, let them perform troubleshooting. Ask them to choose something that demonstrates their specialist understanding, knowledge, and skills, and how they apply this in their practice. And one more thing, ask them to keep the competence requirements in mind when they are selecting their evidence. Good evidence will tick off several requirements. And this brings me to the end of today's video. Hopefully you now have a better understanding about the knowledge and competence requirements for this subsection. And I hope you also have a better idea what questions you can choose to test candidates' knowledge. And my final take-home message? Keep those requirements in mind when selecting questions and guiding the candidate. Bye for now.